Type 1 diabetes is a condition where the body can no longer produce insulin. Insulin is a hormone that controls the level of glucose within the blood. And it's really important that that level stays within a normal range as much of the time as possible, because if not, then over time that can lead to some of the complications associated with having diabetes. Now, in type 1 diabetes, the body cannot produce insulin, so it has to be given by injection. However, the amount of insulin you give will depend on the food that you eat. And so it really isn't the case that you can just eat whatever you like if you have type 1 diabetes, regardless of knowing what it is, because while in theory you can eat all sorts of different things, what's really important is you need to know how much carbohydrate is in each meal that you're eating, because that will determine how much insulin you need to inject. And that's really important because if you inject too much insulin, there's a risk that your blood glucose level will go too low. And anyone with type 1 diabetes will know that a low blood glucose or a hypo is really quite unpleasant. On the other hand, if you don't inject enough insulin, then your blood glucose level will go too high as a result of what you've eaten not being covered by the insulin injected. So first and foremost, it's really important you know how many carbohydrates there are in what you're eating. And that means that each person with type 1 diabetes needs to understand, needs to learn how to assess the carbohydrates in each meal, in each and every meal, because every single meal will have an effect. Now, some people will choose to have some meals without any carbohydrates, and that's fine. But of course, in order to do that, you need to know the foods that don't have carbohydrates, and that all is encompassed in what we call the dietary management of type 1 diabetes. So if you have type 1 diabetes, I really do think that restricting your carbohydrate intake is a very good idea. The reason for saying that is that it's the carbohydrates in the food that make the blood glucose level go up, and that's what we want to avoid. Now, of course, you treat type 1 diabetes with insulin, and you take insulin with each meal to cover the carbohydrates. And in fact, there was a vogue some years ago to say that if you've got type 1 diabetes, with the modern insulins that we have available now, you can pretty much eat what you like as long as you give the right amount of insulin. Now, over the years since then, I've really come to believe that that just doesn't seem to make sense. And why is that? Well, firstly, if you're having a meal with a large amount of carbohydrates, you have to inject a large amount of insulin. That's obvious. That isn't necessarily such a good idea. If you have too much insulin in your system, then there is, of course, a greater risk of having a hypo, which, as someone with type 1 diabetes will know, can be a very unpleasant experience, to say the least. Secondly, a meal which has a large amount of carbohydrates can raise the blood glucose level for sometimes many hours. And that might not correlate with the length of time that the insulin is acting, particularly with shorter acting insulins that we tend to use nowadays. And again, if there's a large amount of insulin in the system, there is an increased risk of the insulin working at a time when the carbohydrate there's a mismatch, if you like. So type 1 diabetes requires treatment with insulin, and there are lots of different insulins available. Nowadays, I really feel that someone with type 1 diabetes should be treated with what is called a basal bolus regimen. That means having two different types of insulin. The first is a basal insulin. That's a long-acting insulin, which is usually given once or twice a day, depending on the type of insulin and how long it lasts. And there are a number now that are available on the market. The ones that we tend to favour are those that are called long-acting analogues. That means that actually they've been, if you like, modified so that their effect on the glucose level is sustained and is stable over a long period of time. And that has huge benefits compared with the older, longer-acting insulins, where from one injection to the next, you really couldn't predict whether the peak effect would happen 2 hours after the injection or 4 hours after the injection. And then the bolus element of the basal bolus regimen is the boluses of insulin that are given with meals. And usually now we use what are called fast-acting analogues that have been modified so that they can be absorbed really quickly from when they're injected, so that they can begin to work as you're eating your meal. And again, there are a number of those that are available now. To be honest, I don't think there are significant differences between them, and any one of the newer fast-acting analogues should work well for most people. Now, one thing that I do recommend is that in injecting your mealtime insulin, it's so important to inject before you eat. There was a vogue a few years ago when these insulins came out to say that actually they work so quickly you can even eat and then inject afterwards. The problem there is that sometimes people would just forget to inject, but more commonly, by the time you finish your meal, your blood glucose level could already be really quite high. And so rather than always having to play catch up, it does make sense to inject before you eat. Insulin pump therapy is something that can be really helpful to a number of people with type 1 diabetes. So essentially what this means is that instead of injecting insulin through the skin several times a day, the user of an insulin pump has a pump which is connected to a little cannula that sits beneath the skin and delivers, pumps a very low flow rate of insulin continuously throughout the day and throughout the night. Now, the great advantage of insulin pump therapy is that the amount of insulin that is infused can be varied automatically. It can be pre-programmed to deliver more insulin during certain hours of the day and less at other times of day. This is particularly useful for people who find that they are at risk of having hypos or their blood glucose level going low overnight. It's also useful for people whose activity levels vary quite a lot. And the great thing about an insulin pump is, unlike an injection where once you've injected, it's working and you can't take it out again, with a pump you can switch it off. And so if you find that your blood glucose level is going too low, or suddenly you're having to be more active, which risks it going too low, you can simply suspend the infusion, which means that it will allow your blood glucose level to rise without having a hypo and without having to take extra carbohydrate, for example, to keep the level up. Now, some people are under the impression that if you have an insulin pump, it does all the work for you. Well, we're not quite there yet. You still need to monitor your blood glucose, and you still need to give the boluses of insulin before each meal. Now, the insulin's in the pump, so you don't need to inject, but what you do need to do is calculate the dose you need for each meal based on the carbohydrate intake, and then tell the pump by means of dialing up and pressing a few buttons to give just that amount of insulin for you. In many people, it can be transformational using an insulin pump, and it's something that I recommend for a number of people where using injections doesn't quite lead to the level of control that they aspire to.